Good evening. India has crossed the landmark milestone of administering 2 billion doses of vaccinations today. This on a day the country reported 20,528 new COVID cases. Now, the COVID-19 vaccination drive started on the 16th of January last year. It's taken 18 months for India to get to 2 billion doses. Now, that is an absolutely staggering milestone, a landmark as it were. But a lot more needs to be done in terms of getting people to accept boosters, because that is so very important. Joining us now, someone at the heart of the mission of Vaccination India, Dr NK Arora joins us. Thanks, sir, very much for being with us. Landmark day, 2 billion plus doses. But are you worried about boosters, the fact that there appears to be a great deal of hesitancy?
So thank you, Vishnu, for inviting me. It's a day of not only happiness, but a sense of fulfillment. There were a lot of naysayers who thought that we will take 15 years, but 1.5 years we are here at 2 billion dose mark. And it's a journey of atmanirbharta and atmavishwas, both. And third, now it's a matter of atmasamman as well.
Right.
As far as your question is very relevant. And this 75 days of giving free precaution dose is something which is very important. And you must have noticed that within last 3 days itself, the uptake has increased by 20-25 times at several places across the country. And it clearly shows that when vaccine is available next door to me and it is available free, people are ready to come forward and take it. Because like yesterday, we had 48,000 immunization centers. So the vaccine has to be available next door and free. And we hope that in coming days, weeks and months, the uptake of precaution dose will increase. And particularly now, since the interval has been decreased to 6 months. So practically everybody who has received 2 primary doses are now eligible for their precaution.
So Dr. Arora, is it true that 92% of Indians eligible for a booster have not taken it so far?
So, let me, you are absolutely right that 18 to 49 age
in the adult group, yeah,
59. Only 5 or 6% people had taken precaution dose, and above 60, about 40+%. So most of the adult population who were eligible even at 9 months had not taken it. Now there is a need, and the program is to really push it in a mission mode so that this precaution dose is taken up by most of the Indians now.
Dr. Arora, so bottom line, now that you are offering it free, that you believe is going to be the decider. If it is available free of cost and available close by, yes, then people will get the vaccine, right? That's what you're sure about.
Vishnu, what I would like to say that it is not only free. I think the more important thing, which is convenience and getting it right at the doorstep kind of a thing, because the public sector immunization centers are very widely spread. You will remember last year we have at 210,000 vaccination centers. But when we were restricting to only private centers, the number of centers were too less in the country. Now, I think with expansion of centers also, that will be also an accelerating force.
When you say doorstep, are you also talking about actual doorstep vaccination, sir?
Yes. So that is also going on. Har Ghar Dastak is a program which is still going on. Let us see how we work beyond 31st July. There is another, we have learned from polio program, that giving immunization at various congregations. So whether it is Kamar Melas or other different kind of fairs, religious gatherings, railway stations, bus stands, so that this vaccine would be available now across in the way we had learned from polio, so that the coverage can be rapidly scaled up.
You know, Dr. Arora, it's so interesting. A year and a half back, when we've done so many conversations, you'd mentioned that, you know, as a policy, it was problematic to do door-to-door vaccination earlier because there was a fear that what if somebody fell unwell, right? Then what do you do? Better to have a large area, and then if someone falls unwell, you can deal with them. But that thinking has evolved. That's interesting. Is it because of your confidence in the vaccines?
Yes, absolutely. Now we are confident that immediate allergic reactions are extremely uncommon and they can be managed by one injection, which is available with every vaccinator. And then the person, there is sufficient time for the person to be transported to this. So we have huge confidence, and we are among the few countries across the globe where we are ready to give it right at the doorstep, just like polio. And polio vaccination and measles vaccination has given us a lot of confidence to do that.
And could you give us some numbers of how the doorstep vaccination rollout is working? Do you have some numbers? How do you intend to ramp up coverage, etc.?
So I think house to house or Har Ghar Dastak started on 1st of June. And it is to go on till 31st of July, but we hope that it will continue beyond that. The additional numbers covered, I won't be able to give you in the process, but now the strategy from 15th onwards is also to cover up all various congregations, fairs and social gatherings, religious gatherings, plus railway stations and platforms. So I think we will get to know how this ramping up and how much ramping up occurs with this strategy. Will let you know.
But that's interesting. So railway stations, sir, and of course there are lakhs of commuters in the busy railway stations. So you'd have a couple of sites where people can actually go get their dose.
Yes.
And where are you going to start that, sir?
I think it will be simultaneously, and particularly those heavily where the traffic is maximum and where migrant population is there or where too much of traffic is there. Those will be the initial places.
And will all vaccines be available, sir, in these locations? Because we aren't mixing and matching as yet.
So as we move forward, there is, as you have seen, there is no policy framed in stone kind of a thing. We are, as science and as evidence emerges, we have kept the policy changed. And so whatever vaccine will be available required for precaution dose, that will be available at these vaccinations.
And apart from railway stations, sir, what other areas, in terms of...
Melas like Shravani Mela, Kanwar, wherever Kanwars are there. I was there 2 days ago in Deoghar.
Right.
Here, huge, millions of people come. So
right.
Their vaccination centers are going to be set up. Similarly, in Maharashtra, where there is a huge religious gathering. So wherever these things are there, it will be the vaccination will be available in these sites.
So why was the interval for boosters reduced from 9 to 6 months?
So there were two reasons. One is that the Indian evidence, whatever studies have been done, whether it is CMC or others, it showed these studies were done at 6 month interval. So that was in the evidence, and the other is global evidence also was kind of complemented into this, and that was the reason that we reduced.
Doctor, yeah, go ahead.
Also, although with 9 month also the uptake was not great, but we have reduced it, and now practically everybody comes into that eligibility framework, so that now it can be given at a much larger rate without thinking, and a more number of people can come, whoever has received their primary dose.
Dr. Arora, the reason I'm asking this is because, we knew all along, even last year, based on international data, that the impact of the vaccine starts waning after 6 months. But we insisted on 9 months, and we were waiting for our own science. So, what really has changed? Shouldn't we have gone by the, it was pretty straightforward science.
No, so it is not a understanding in hindsight.
Right.
You must see that virus has behaved very differently in India.
Yep.
Omicron, while it is still causing quite a big havoc in North America and Europe, thousands of people are still dying every day. In India, it has not worked that way.
Right.
And so, as you will remember, persistently, I have been saying that the context and the local epidemiology is important. And there were a lot of also discussion whether a booster is at all required or not. And we were primarily, the world has now realized it is not just antibodies which are important. It is the cellular immune response which is also important. So keeping all this, the decision of 9 months and now to 6 months has been taken in taking all these things into account.
So, sir, the next question is obvious. What happens after a few months? Will I need a fourth booster? Will you need a fourth booster? Or is this going to be endless?
First of all, none of us is an astrologer, so we can't say. Although people have tried to give a fourth dose also, but clearly, I think we are not in that kind of a state. Almost 90% plus of our population has been naturally infected as well. But equally important, I would like to share with you the information that India has already embarked on a program for next generation of vaccines for COVID. So vaccines which have a wider coverage and has durable immunity. So over next few months, trials may start on these vaccines. Some of these newer next generation vaccines have already kind of are in advanced stage. So I think we have just not stopped. So way forward, we are preparing ourselves for this pandemic, and not only that, technology platforms are there with us so that we can take care of any other eventuality as well.
One or two more questions, because this is fascinating. You're talking, of course, of the magic bullet against COVID. One vaccine which gives us, So where does India's science lie on this? At what stage of have we trialed it as yet? Are we starting to trial it, or are we still prototyping it?
So that's what I said. Over next few months, the trials will start.
Who's doing this, sir? Whose drug is it, sir?
I think there are several ones. I think we let us wait. All those. It's a what I would say a partnership and engagement, collaboration between academics as well as industry. So there are 4 or 5 such collaborations ongoing.
And the government is a party to it, and the government is a partner.
And government is catalyzing and supporting these activities.
And sir, how many months before we know whether this is successful or not? Because it may not be successful, and we need to be ready either way. The science is difficult.
We are completely. These are called high risk investments. We are all ready for it, and over next 2-3 months we will have more news about it and what further can be done on this.
One final question: when will Corbevax be granted WHO clearance? The reason one asks is, children getting Corbevax, 2 doses, a lot of them would want to travel abroad, etc., etc. That doesn't happen that easily. You still need to get an RT-PCR, whereas if it was WHO recognized, then that would not be required in many countries.
Vishnu, one thing I will like to clarify here, that now nowhere people, there are only 8 or 10 vaccines which are WHO EUL, emergency use listing. There are more than 30 odd vaccines which are being given across. So if you have a vaccine certificate, that is good enough. That is not a problem because people can travel. So that, I think we should leave aside that issue. But the important point you are saying is, if EUL is given to an Indian vaccine, then other countries are ready to buy it in that sense. Then it becomes a greater possibility. And as I know, Corbevax is in advanced stage. They have probably submitted all their papers, but I do not know the current stage.
All right, sir. Exciting news. I think, just boosting immunization in terms of boosters in railway stations, at fairs, in melas, in a country as large as ours. That's going to be something that's not been done anywhere in the world. And it's going to be huge. Thanks very much, sir, for being with us, sharing that piece of news. Thanks very much.
Thank you very much.